Hi, I'm Deborah.
And I'm Lawrence.
And today we're going to talk about a study that came out about a week ago, and also about therapy's role in treating moderate to severe depression. So the study came out, and they looked at, I think, 153 people aged 15 to 25. And what they did is they divided the group into two parts, and it was double blind, so even the people who were running the study didn't know who was in what group. So one group had cognitive behavioral therapy and a placebo, so in other words a sugar pill, and the other group had cognitive behavioral therapy and an SSRI, which I think was Prozac. So their conclusion was that there was no difference between the treatment that was just the CBT, the cognitive behavioral therapy, and the CBT with medication. And so basically their conclusion was that therapy alone should be the first line of defense, the first treatment on its own for moderate to severe depression.
And already I disagree with that.
And I do too. Now let me just point out that neither one of us has any kind of medical degree, so we are not giving medical advice.
I'm a 16-year-old and you were an English literature major.
Yeah, I mean, well, I've been writing about depression since '95 and have some of my stuff has been in textbooks.
But you're not
and
okay.
Published.
You'll need to show me that then.
Okay. I didn't get a copy of it. Anyway, they wrote and asked permission.
Really?
Well, I didn't care. They may have offered, but it wasn't important.
Whatever.
Anyway, I'm going to cut that part out.
No.
Okay.
That's interesting.
You want me to leave the weirdest things in? Anyway, so we're not giving medical advice in any way, shape, or form. This is our opinion. We do both have a lot of experience with depression treatment, and that's also what we're going to draw on. So my first problem with this is just that these patients had moderate to severe depression. Okay? So moderate to severe depression. I mean... And
they're experimenting on them.
Well, yes. I mean, granted, they have...
I just want to raise the ethical dilemma, first of all.
I agree with you. I was very concerned about that. I mean, I would have been much more comfortable if the patients had mild to moderate depression. But if you have moderate to severe depression, your life is very likely, to some extent, a mess. And your days are basically hell.
And having people run tests on you just to figure out, oh, is this going to work? It's not... I don't think that's ethical.
I mean, it's the way that we find things out. And...
Yeah, that's true, but it's still... doing it this way is unethical.
So it does bother me. And the way I looked at it is, let's say these were people who had had heart attacks. Or had heart failure of some kind. I really hope they wouldn't, but would they do a study in which they had one group do diet and exercise and a sugar pill, and another group do diet and exercise and heart medicine?
Exactly. That, nobody would... nobody would be...
I hope not.
Everybody would be like, oh, the ethics. That's exactly what they're doing.
Well, the problem
they're screwing with people's lives.
And these people should know better than anyone who are running the study. Depression could be a fatal disease.
Exactly.
So 2/3 of the people in the study, in both groups, had suicidal ideation. Okay. No, actually it was 3/4. It wasn't 2/3. 2/3 is 66%. It was over 75%. So that's 3/4 of the people had suicidal ideation. Now, so the group with the just therapy and the sugar pill, there were 5 suicide attempts. the group that had CBT and Prozac, 1 suicide attempt. Now, granted, that's that's probably within the margin of error.
But still.
So you have a total of 6 people, but still.
You're risking people's lives to do this stupid experiment.
But still.
It is putting people's lives at risk.
And
I think that's horrible.
But it's not just that. I mean, that's the worst thing, is it was putting their lives at risk. The next worst thing is their conclusions notwithstanding, and I think we talked in our video about do cell phones and social media cause depression, about trials and what's the word I'm looking for? Experiments, whatever. Studies. That's the word I'm looking for.
Yeah.
You wouldn't know that I worked in the Department of Chemistry, would you?
No.
I'm tired. I'm tired.
So am I, but I'm still completely lucid.
I have MS and I'm 40 years older than you. So just wait till you're my age. You can't take study results at face value.
Exactly. No, never do that.
Never.
Never.
If it's something that affects you, don't just read the articles and the press release. Go look at the study. And actually there was also an article that came out, I think, a couple days ago or yesterday, about how studies spin the results.
Yeah.
Like, it was over 50%.
That's obvious. Because you have an agenda.
Yeah, I mean,
in a lot of cases,
my reaction was kind of like, duh.
The researchers have an agenda.
Yeah.
A lot of the time, they want to prove something.
In many cases, they have an agenda. And here, so it was, now granted, I mean, studies have to be done to make advances and to improve people's lives.
I know.
Okay.
But still.
So this was definitely a concern. So you had a very large percentage of people in the study who were suicidal.
Yeah, that's not okay.
Yeah, no, I mean, that bothered me intensely. The other thing is that by my own personal experience, when I first got diagnosed, it was recommended that I take medication, antidepressants, and for reasons I'm not going to go into, I didn't want to. So they wanted me to do medication therapy, start both those at the same time. So I only agreed for the first 6 months to the therapy. Well, the problem was that I was so profoundly depressed that I really couldn't participate in the therapy. Okay? I mean, that's my experience. Maybe other people who have severe depression don't have that problem. But that's another thing that bothers me.
Yeah.
If you have severe depression, you're having trouble functioning.
Yeah, exactly.
How are you supposed to really participate in something?
How are you going to be used?
You have to be present for therapy.
Exactly.
Okay, so that bothered me also. The other thing was there was a study that came out recently about one type of CBT, and forgive me for not remembering exactly what type it is. Apparently, it loses its effectiveness after 2 years.
Yeah, I remember you were talking about that.
So the effects of the CBT after 2 years,
there's a chance they won't make a difference anymore.
I mean, that's bothersome. I mean, a CBT is very good for certain things, but it's become very popular, and it took a while to catch on, but it's become very popular. But it is only good for certain things. And a lot of times people who have depression have issues, childhood trauma, dysfunctional family that they grew up in, other kinds of trauma that they've gone through, maybe not related to their families. And that they have developed certain coping mechanisms and stuff, and just covered up in some cases whatever the trauma was. You cannot fix that with CBT. Okay, you can fix some of the effects, but you can't fix it with CBT. So I mean, I don't want to go on a whole anti-CBT thing, because CBT is good for certain specific things. The other problem I have with this is most insurance companies and employers are reluctant, because the employers tell the insurers what they're willing to pay for. Okay, they develop the plan with the insurer. Therapy is expensive. Medication isn't. Okay, I'm a big proponent of therapy, as you know.
Yeah.
Okay.
I mean, it's made a difference in my life.
Both of us.
I'm all for it.
Both of us feel very positively about therapy, but the thing is, let's say you have insurance that is very stingy with therapy. Okay.
Exactly.
Or just won't pay for it altogether. Therapy is expensive. So what are you supposed to do?
Either you let them gouge you for therapy, or you don't do anything.
The thing is, what if medication is your only option? So this study is saying, and could influence some people and some medical professionals.
It could make them make some decisions that aren't too wise.
Yeah, I mean, say no. Because what this study said is the first treatment option for young people should be therapy. First of all, the other thing is that doesn't necessarily apply to everyone. Is different. You cannot make a blanket treatment recommendation. You just can't. People are individual. Their depression is individual. It just...
Exactly. One person, CBT can do wonders. Another person, it can have no effect whatsoever.
Or therapy, not necessarily CBT.
Whatever. Exactly. No, you cannot... There is no catch-all solution.
So, should therapy be the first line of defense? It depends.
Yeah.
Okay?
I mean,
it totally
different.
Depends. Everyone is different. Okay? And it depends on the severity of your depression. It depends on other things. What's going on in your life? Well, if you're a teenager, okay, you're getting ready to probably apply to college or join the workforce. Okay, you might be, getting new skills to get a job after high school. So you got a lot going on. Okay, not to mention you don't want to miss what may not seem like the best years of your life, but
You'll treasure them.
It's a pretty decent
phase when you have to start paying taxes.
Well, yeah, there's that. But I mean, you're also developing your body and your brain are developing. Your personality is developing. Your interests, your aspirations.
Things are changing at a rapid rate.
And to me, it seems irresponsible to say, oh no, everyone should just have therapy, specifically CBT. I think it was, may be wrong, maybe they may have just said psychotherapy. But
they said just psychotherapy in general.
Well, I mean, instead of CBT, I think they just said just psychotherapy. You're right. So I just feel that this was irresponsible in a lot of ways. The person who should decide the treatment is you and your doctor, medical professional, whoever it is you see for your depression. What I think is the most important thing you can do is be well informed when you work with the doctor to make that decision. The other thing is therapy takes a long time. Okay, so I mean people who are severely depressed get upset when they find out they're going to have to wait a few weeks for an antidepressant to take effect. Okay? The problem is with therapy, it's not even close to instantaneous. Okay,
it can take years.
It can take years. I know this has been kind of a rant in some ways.
Yeah, I was about to start telling you we need to wrap this up.
Yeah. So I realize that this has been a little bit of a rant, but we both get pretty disturbed when we see.
Yeah, no, I'm pissed off.
Yeah, these studies, because we've both been there. we've both been teenagers and kids with depression, and we know what it's like, and we know it's scary, and we want to make sure that you're in a vulnerable position, okay? As a kid or as a teen, you don't have as much power, and people don't always listen to you as much as they should, even about your
people
own
rarely
life.
listen to you.
Your own life, your own health, your mental health, and so you have
It's up to you.
It's up to you. So even if you have wonderful, loving parents who want to support you in every way, they aren't necessarily educated about this, and a lot of people, I especially had this with my grandparents, everything to them, everything a medical professional says is gospel. So we hope this has been helpful. That really was our goal with this video, is to try to give you the information you need, and we hope we
want you to be
done
well
that
informed.
with some ranting too. So sorry about that. But we I think that it's important that people know we're really passionate about this.
Definitely.
We don't have an agenda, but our point of view is we want what's best for you guys who see this, especially when you're younger. It's really important. So anyway, be well, and we'll see you next time. Bye. So you can tell this bothers us.
Why do you never let me speak?
Sorry.
You always
Sorry.
interrupt me.
Okay. It's HD.
Shh. Hey, I have it too. But I was waiting patiently just
You
now.
were.
Wow.
You were.
I'm
Sorry.
hurt.
I'm sorry.
Okay.